Hi, myself Dr. Mangala Sharma, consultant in Obs Gynae in Cloudnine Bellandur in Bengaluru. So today we will discuss about the FGR. So what is FGR? So when the fetal growth restriction, when the fetus does not grow properly according to his or her gestational age in utero. So nowadays the FGR condition is so common. Almost 10% pregnancy is affected by this. How we can diagnose? So we can diagnose by the clinical examination. So when the patient comes, we do the clinical examination. In clinics, we check the fundal height of the uterus. If we feel it is less than the period of gestation, so we do the ultrasound. In ultrasound, we see the fetal growth parameter. If it is smaller than the period of gestation or the fluid outside the baby is less, then we advise the Doppler study. If the Doppler parameters are abnormal, then we confirm our diagnosis. So how can we monitor the FGR after the diagnosis? So we can monitor the FGR with the Doppler study. With the close monitoring or with the help of doctor, we decide the timing of delivery. Also, we can ask the patient to keep strict counting of the fetal movement. So by the help of all this thing, we can proceed the pregnancy. So next thing, what are the risk factors of the FGR? So there are the three factors. One is maternal, second is fetal factor, third is the placental factor. So maternal factor are if the age of mother is more than 35 years or below the 19 years, or there is a risk of smoking, alcohol or caffeine consumption or any drug abuse, that also can cause the FGR. Torch infection in pregnancy or any chronic illness like the hypertension, diabetes, any connective tissue disorder like the rheumatoid arthritis, Aplar syndrome, all these things can lead to FGR. What are the fetal factors? In case of congenital anomaly, any genetic factor, or in twin pregnancy also can cause the FGR. Third thing is a placental factor. So any defect in the umbilical artery like the single umbilical artery, or there is a defective insertion of the placenta in preeclampsia, this thing also can lead to FGR. Or there is a placental hemorrhage or subchorionic hematoma in the early pregnancy also can cause the FGR. So next thing, how can we avoid the FGR in pregnancy? So we always advise the patient to do the preconceptional counseling before starting the pregnancy. We advise to get pregnant before the 35 year of age. If the patient is high risk, we start low dose ecosprin in first trimester of pregnancy, which also reduce the risk of FGR in the later half of the pregnancy. Or in preconceptional counseling, we modify her the lifestyle. We ask to stop the alcohol consumption, smoking, reduce the caffeine consumption. These all things we can help to reduce the risk of FGR. And third thing, by the optimizing drug for the chronic illness whichever she was taking, that also help to reduce the risk of FGR. So by all these things, or with the help of the preconceptional counseling, we reduce the perinatal mortality and morbidity in the pregnancy.